It's not about quantity here, and it's about quality, and I think that's what it should be. Because anybody can drill some holes, but knowing how to do it right and knowing how to graft properly and doing all those foundations is what's going to lead to success in the future. So yeah, I think that focus on the foundation work is so crucial, and I think this course gets it right.
Lincoln has a way of teaching you to do things one step at a time and how to perfect each individual step, and the actual placement of the implants, not much of it. So I think this course is really great in teaching us the nuance, like raising a flap, doing a graft, putting stitches in, all the stuff that a lot of the other courses overlook.
The facilities are fantastic, the staff are excellent, the course content was brilliant, the variety of patients was excellent. Certainly took me out of my comfort zone, but then brought me back into my comfort zone to feel comfortable in the knowledge and the skills that I gained, really. I mean, it's been a revelation for me. I've learnt a lot.
I just thought that we'd be following one patient from start to finish, do a simple implant and just have Lincoln giving me a few principles, but no, we were seeing a patient for some pretty complex surgery which we wouldn't dare to touch back at home, and it was a really, really interesting experience which I don't think you can get anywhere else.
After learning from Dr. Lincoln Harris, I know what is the perfect flap, how to raise it properly, and above all, how to suture it back properly. I have learned soft tissue grafting from him. It was amazing. The way he plans his implant procedures are, he will guide you where the gums or tissues are going to be after the procedure. So we plan the placement first, then we place the implant. We are not placing the implant where the bone is, we are placing the implant where it should be and where the gums are going to be, gum profile.
Starting the course with a soft tissue model and learning those sorts of things, I think it's a fantastic skill to have been taught at the beginning, because once the soft tissue and the grafting has been done, the implant placement is made so much easier.
You're actually doing things not just academically, but hands-on. Gives me the muscle memory. That's the important thing.
Whatever patient was there, and we just had to look after them from start to finish, and that's quite sort of refreshing, because a lot of these other courses that you hear about, you just whack some implants in and you never see them again. You never know what happens to them. You feel way more responsible when you have to see the follow-up of your patient. So everything you do suddenly becomes much more important, and every little mistake you make, you go back and you fix up. You can't just be good enough, it has to be perfect.
Having done the course, now I'm more confident offering implants without having to refer off to the specialist. To me, that's really rewarding, and I've seen myself grow quite a bit.
Implant placement, nobody can teach you better than him. The angulation, placement, bone grafting, and an eye for the angulation of your implant. That's what I've learned from Dr. Lincoln Harris.
You generally go overseas to do some really complex surgery, but you actually manage to do a lot of pretty complex surgery here, except that you're held to high standards because Dr. Lincoln has to basically act as if he's treating the patient himself, and it needs to be acceptable by his standards. And so, yeah, the results of your surgeries actually matter a lot more to you.
Here we've had follow-up on patients, we've seen some of our successes, some of our failures, and it's great because not everything's going to be perfect, and it's really refreshing to see. And the 3 modules spaced out in that time allows us to do that.
I feel like I learnt a lot more than I expected to, in terms of width of knowledge.
Yeah, don't think about it, just do it. You won't regret it.